Meanwhile, back here in the United States, Dr. Spack coalesced a group of individuals from around the world, including the clinics in the Netherlands and in Sweden and in the United States, and they put together a set of guidelines. The committee excluded anybody with a contrary opinion. So Dr. Zucker, who is the pioneer, essentially, in this country and this continent, with transgender medicine, was not included to discuss or create the guidelines that the Endocrine Society in the United States, professional organization, was going to adopt. He was left out. Dr. Paul McHugh, who had written extensively from Johns Hopkins, and who previously had been what was called a preeminent, world-renowned clinician, he was left out as well. So in 2009, they put together the guidelines. They did send out a little notice saying, if you're interested in reviewing them and have any comments, please let us know. And at that particular time, I wasn't paying attention. I was a member of the Endocrine Society, but I didn't bother to turn in any comments. I just kind of went by the by. And lo and behold, this comes out in the Endocrine Throwaway Journal. It is the Transsexual Treatment Guidelines, and they outlined those in this particular journal, but it was published in the Journal of Clinical Endocrinology and Metabolism. So the guidelines in a nutshell are, do a psychological assessment. It doesn't tell you how deep. Just say, hey, are you troubled? Check mark, okay? That's all we do. We want to affirm and transition any child who states they are born into the wrong body. We want to block puberty as it begins. At age 16, we want to consider putting them on cross-sex hormones. At age 18, if the patient desires, they can sign on with informed consent for corrective surgery, so-called corrective surgery. Of the 22 guidelines, only 3 meet any degree of scientific validity, according to a standard scale used to create these guidelines. It's used sort of internationally. Of those 3, those were all about concerns about the puberty-blocking hormones and the cross-sex hormones and what would happen to these patients medically that could be adverse. Okay? The remainder of them were based on very little science or absolutely no science whatsoever, and yet the guidelines were published. So the revised guidelines have just been put out by the Endocrine Society. They felt they needed to be updated because of the sudden push in transgender health issues. They added additional concerns about the fact that these patients might have issues with fertility that they should be told about. Now, you're talking to a 12-year-old child about their infertility, lifelong infertility, and cancer risk from cross-sex hormones. And you expect that child to grasp that and understand that and assent to going on the hormones, or have the parents take the responsibility for that. Are you kidding? Are you absolutely kidding? There is no other area in medicine except for chemotherapies for death-causing cancers where that would even be considered as an option. And we're not talking about death-causing cancers here. They suggested earlier cross-sex hormone therapy than waiting till 16, suggested earlier top surgery, that is to say mastectomies in girls, should be done before age of consent. And once again, they lacked reasonable scientific evidence in all but 4 recommendations. They removed all references in these guidelines to Zucker, whereas before they'd had them in there. These are the articles that you heard about, the New Atlantis article that Paul McHugh and his colleague, Dr. Mayer, put together. This was a beautifully written, extensively referenced article that had to be published in the New Atlantis magazine, primarily because no other reputable journal would print it because it wasn't politically correct. On the right side, you see the article written by Dr. Kenneth Zucker before his clinic was shuttered, showing the absolutely essential guidelines for treatment of transgendered persons. Not to be left out in terms of guidelines is the Pediatric Endocrine Society, which is a separate organization, decided they wanted to go through and create their own guidelines. For the 2017 guidelines and for these guidelines, I made sure I gave them input. Not a shred of what I said was ever answered or respected in terms of how the guidelines came out. Not that I'm an important person, but they did ask for input. I gave it, and it was as if I never existed. The guidelines are emphatically restating the Endocrine Society guidelines and suggest that all the treatment should be covered by insurance, and that was the most important thing. Now, you hear over and over again, the American College of Pediatricians is a tiny, racist, bigoted, homophobic group from the South. They're all religious zealots, okay? And they are on the hate list of the Southern Poverty Law Center, proud to say, okay? And that makes us feel really good because there's a lot of good company on that list of very decent human beings. But the American Academy of Pediatrics, whose membership is now upwards of 65,000 members of pediatricians and pediatric healthcare providers otherwise, endorses affirmation of transgender and treatment as guidelines of endocrine society say. How in the world can 66,000 pediatricians fall behind something that is so absolutely out of control? Why did the American Psychological Association take out gender identity and make it gender dysphoria? Don't these thousands and thousands and thousands of professional individuals understand that there should be some kind of balance, and there should be a little give and take, and perhaps two opinions stated, or at least admit that there's another opinion that should be considered? How it happens is that the general membership is allowed to have special interest groups, and the special interest groups are a tiny fraction of the membership, and they have a bee in their bonnet. They have a cause that they want to go for. Then that special interest group interacts with the executive committee that governs all of the decisions of policies made for the huge membership. In the American Academy of Pediatrics, that executive committee is 15 people. Membership, 66,000. So those 15 people listen to the special interest group, and all of a sudden, it's adopted by the entire society as if 66,000 people agree. And that's published. The American Academy of Pediatrics, the American Psychological Association, the American Association of Family Practitioners, the Endocrine Society all agree, and they're professional societies, and by God, the medical world totally supports this, and you fanatic, crazy Southern religious bigots are a small splinter group, and we shouldn't listen to you. We get that argument all the time. So, as this is like a dominoes, the APA, American Psychological Association, publishes something, the American Academy of Pediatrics jumps on board, and then the Endocrine Society jumps on board, and et cetera, et cetera, et cetera. Suddenly, the medical professionals are all in favor of Obamacare. The medical professions are all in favor of transgender transitioning. And in truth, the physicians who work their bones to death every single day and take care of patients where the rubber hits the road have no idea what's going on at the level down where the rubber hits the road. So it was alluded to by David Pickup this morning that why in the world is this transgender thing being pushed by the LGB community? When did they add T, and why did they do that? Well, as he pointed out, if you get transgenderism as born that way and a civil rights in terms of being transgender are protected, then male and female go away, and the whole issue of acceptance of same-sex attraction all of a sudden is moot. It makes no difference if there is no sex one way or the other. So what does the T stand for? It's interesting historically. Originally it was transsexual, then it became transgender. Maybe you can throw transvestite in there as well, as if that is, and it's been blended together by LGBT. They are almost as if everybody that's in the trans community is all the same, which of course is absolutely hogwash and nonsense. Transvestite can be heterosexual males who just absolutely love getting dressed up and putting on nail polish and high heel boots and kinky boots, okay? Or they can be like drag queens, which there's a profession that are not necessarily, they can be homosexual, but many times they are not. The famous one being RuPaul, who says, you can call me anything you want to, I know who I am, okay? And he refers to himself as he all the time. But he is brought into the trans group as if he is actually transgender, when the case is absolutely untrue. The advantage of inclusions in this alphabet soup of LGBT are anchoring transgenders as civil rights, attempting to legitimize born that way, and the wider audience on the internet, which is a huge recruitment tool. The U.S. landscape in 1970, transsexual clinic at Hopkins was established, and in 1984 it was closed. In 2006, Norm Spack opened up his Boston clinic. 2009, Endocrine Society guidelines were published, and since then, we're upwards of 50 transgender clinics nationwide. So originally, it's like mushrooms sprouting. The map that had just Boston on it, you see all these mushrooms growing here. There are clinics all over the place, all with experts at the helm, so-called, none of whom have ever been really trained in transgender medicine. The battle to return to science is important. Only gender-affirming experts are invited to speak at academic meetings so that the alternative opinion cannot be heard. I attempted to do a balanced presentation in a meeting in Houston Austin, that was held last year for the Endocrine Society, the American Association of Clinical Endocrinology, AACE. And we wanted to have a balanced presentation. What was presented was just the transgender affirming side, and no one else was invited. The publication after that meeting was describing how forward-thinking the organization was because they had embraced this new trend that was new science and needed to be paid attention to. No mention of counter ideas. The counseling to return to natal sex identity is outlawed in some states. You cannot do that. Your license will be taken away and you could be jailed. LGBT activists seek to destroy the opposition through academic influence. Dr. Mark Regneris, who wrote the paper on issues with kids raised in same-sex families, was removed from his faculty position temporarily. The university ended up having to reinstate him. But his journal article was pulled temporarily, and then when it was reviewed and found to be valid, it was reinstated as an article that did not need to be rescinded. There are many people in academic medicine who keep their mouths shut because their jobs depend on not opening their mouth. If they feel strongly about transgender issues and do not want to affirm patients with therapy, they just lay quiet for fear that if they're not tenured, they're going to be fired. So the major medical journals refuse to publish anything. The ones that we all, New England Journal of Medicine, Journal of American Medical Association, the Journal of Pediatrics, JCE&M in the endocrine world will not publish anything that is counter to the gender-affirming concept. So that's why Dr. McHugh had to publish in the Atlantis Journal. It's because it was a beautifully written article that was polished and would have done beautifully in terms of review. It just wasn't politically correct. So that they forced them to the margin. And then they're doing research providing benefits through affirmation through using a different kind of standard for clinical research. There are ethical guidelines for clinical research that you have to agree to before you do a clinical study. First of all, there must be informed consent. Every aspect of what you're doing as a proposed treatment must be explained, the good, the bad, and the ugly, okay? Not so in gender identity research stuff. Clear assessment of benefits versus harm. The harm, so-called, in not affirming is that the patient has a high risk of suicide. The problem is the high risk of suicide exists anyway. It's not made any worse. Absence of bias, presented as you need to have a balanced approach where you do review those indications that are counter to your proposal, bring them up in your proposal, and deal with them and show that your hypothesis might disprove them, but they will be included as a concept. None of that is being done in the transgender research that's currently going on. Independence of safety by an institutional review board with stopping criteria at the very first sign of any adverse effect that affects the patient. So here we have cases already of adults whose lives have been totally tragically ruined, committing suicide or standing up finally and opening up and writing books about how horrible their lives have been in this new transition state. That would be a stopping criteria for the study before it ever got started, but all of that is completely ignored. There's currently funded an NIH study with 4 centers in the United States. They're recruiting kids who are 5 years of age and older, and they are going to affirm these children in all ways, and then at the end of 5 years, they're going to find out if they're happy or not. The problem is there's no control group. They didn't choose 40 kids or 80 kids and divide them into 2 groups randomly and say, we're going to affirm you, and then we're going to use the other non-affirming criteria and psychotherapy and see what happens at the end of 5 years in terms of levels of happiness. There is no control group. That would not pass muster in any scientific venture anywhere else. And the evaluation of how successful you are is by asking the parents and the researchers how they have assessed happiness. Again, no independent evaluation of that at all. It's totally biased. It's going to essentially stop puberty, and we're going to have a group of kids moving forward that are treated by something that is an experiment for which they already are going to get the answer they know they wanted. So the details of this study, you cannot find them on the NIH website. It's totally non-existent. You just have to know the study exists by reading about the claims that the study is starting and where they recruited patients from. So there's fallout in the local communities. School boards are railroading through regulations without public hearings. It's happened here in Texas. It's happening in Decatur, Georgia at this point in the Atlanta area. Large corporations are threatening to pull out of municipalities because of thoughts of if you don't accept transgender rights, we're not going to do business with you and your community will fail. And then gender centers of excellence are actively treating patients from age 3 and up with affirming therapies, cross-sex hormones after puberty blockers, in advance of the data showing that it is at all safe or effective. It's already happening. So what can we do to turn back the tide against it? We can always begin with a statement that truly shows that we are compassionate about these children. We do not hate transgender patients. We do not treat them poorly when they come to our offices. We are compassionate. We go to the root of the problem. We find the therapist, such as David, who will go back and look at the family structure and figure out the roots of the reason why this child feels they are in the wrong body. We will stand firm with our scientifically based convictions. We invite dialogue with the other side instead of just throwing bombs over the fence, the way they do at us. We've invited them numerous times. They will not answer the invitation. And we join with broad-based group of diverse backgrounds. We have in our side lesbian activist groups who are totally and thoroughly disgusted with the concept of raising a child and affirming the wrong gender. Sounds like crazy. We're suddenly in partner with radical feminists. But they feel that there's no science behind what's being done, and they want to stop it as well. And then we never are afraid to discuss how our faith helps us in our decision-making. And as scientists, one of the things I remember from my fellowship days is arguing with a fellow from Israel who was in training, and he said to me, "You know, Quentin, the more we know about science, the more we know there is no God." And I looked right back at him, I said, "Zvi, funny, but the more I know about science, the more I know there is God." So we encourage the victims of drug and surgical therapy to speak out. Renee Jacks has written this book, Don't Get on the Plane. If you look carefully, it's a Trans World Airlines plane from back in the day. Very clever. It's high time that we point out that the emperor is naked. Thank you.